Morning, everyone. Bonjour à tous. Je suis heureux
I'm pleased to be here today with the Deputy Prime Minister Freeland, Minister Anand, and Doctors Tam and Njoo. While we are still fighting the third wave, our absolute priority remains the safety of all. Yesterday, we held our 30th First Ministers meeting since the start of the pandemic with the premiers from provinces and territories. The message was clear from the premiers, and we were clear with them. We are here to support you.
another productive meeting. We talked about vaccines, testing, and what we can do to beat this third wave. We also talked at length about borders. Premier Ford asked that we suspend the arrival of international students. Because at this time, Ontario is the only province requesting this, we're happy to work more narrowly with them. We'll be reaching out to their officials today to formalize that request. Again, I want to be clear. This is not the time to travel. On land borders, as a reminder, anyone who comes to the U.S. land border has already been tested in the U.S. in the last 3 days. Then they have to get tested again. And everyone has to quarantine for 2 weeks and do another test on day 8. We're enforcing very severe consequences for anyone breaking these rules. Yesterday, in addition to all this, Deputy Prime Minister Freeland provided an update on the budget as well. I also took the opportunity to congratulate Premier Silver of Yukon on his re-election. I look forward to continuing to work with him on everything from the fight against climate change and creating affordable childcare to our commitment on building a stronger relationship with Indigenous peoples. In fact, I'll be calling Sandy later today so we can discuss these priorities further. As I told everyone around the table last night, it's vital that we keep working together. We're following the situation with this third wave closely, especially in places that are hardest hit. Yesterday, Alberta reported their highest single-day total since the beginning of the pandemic. Premier Kenney announced new restrictions to slow the spread of the virus, and our government is ready to work with the province to provide support. For Ontario, medical teams from the Canadian Armed Forces began arriving in Toronto on Tuesday night, including critical care nurses who will work in the ICUs. This first deployment of 55 members of the forces will be providing assistance to Sunnybrook Hospital and its mobile units. On Tuesday as well, a healthcare team from Newfoundland and Labrador arrived in Ontario. They're helping at Toronto General Hospital. Like I said before, we are actively working with the Government of Ontario to determine how else we can support them. For Nova Scotia, where cases are also high, we've deployed 60 Canadian Armed Forces members to testing centres to help stop the spread of the virus. And for New Brunswick, we've approved the province's request for assistance for long-term care homes. The Red Cross will assist in up to 3 facilities until the end of June. Nunavut has also requested additional support to deal with their current outbreaks. We're moving quickly to keep people safe by sending more PPE and health equipment and by providing support for households in isolation who need food or mental health services. We're also engaging with other provinces that are hit hard by this third wave to see how we can help. We're ready to send any resources needed to protect you and your family. And of course, we're continuing to deliver PPE, rapid tests, and vaccines. So far, we've distributed more than 15 million doses of vaccines right across the country. Wednesday, almost 1 million doses arrived in Canada, including our first shipment of the single-dose Janssen vaccine. Starting next week, we will be receiving 2 million doses a week just from Pfizer alone. This will mark another major ramp-up. We will continue to work with provinces and territories to get these doses to Canadians as quickly as possible. Il y a de plus en plus de gens vaccinés.
There are more and more Canadians that are vaccinated in several provinces. Vaccination will be open to the general public soon. This is encouraging news. Over the last year, we have often repeated that each effort counts. Each effort means that we can better protect our healthcare workers, our families, our neighbors, and all Canadians. by wearing a mask, by maintaining social distancing, by staying home, we help save lives. And it is also true with respect to vaccinations. Each vaccine dose counts. As soon as it's your turn, I urge you to take an appointment to get your vaccine. It's important to protect oneself and to protect others. And it's only by getting vaccinated that we'll be able to get through this pandemic and get back somewhat to the lives we used to have. At the beginning of the crisis, we promised families, workers, and small businesses that our government would be there for them. We are doing everything possible to make sure that our economic recovery is as robust and swift as possible.
Finance Minister Freeland introduced the Budget Implementation Act in the House of Commons. This is the next step forward on the plan we laid out in last week's budget, a plan to get through the pandemic, create jobs, and make sure our economy comes roaring back. This bill includes extensions of support programs that have been a lifeline for millions of Canadians, from the wage subsidy and the rent subsidy to the Canada Recovery Benefit and the Recovery Caregiving Benefit. We're facing a very serious third wave, so we need to make sure we can deliver support to the workers and businesses who rely on these programs. Of course, that's not all this plan lays out. With this legislation, we're also setting the foundation for strong economic growth, with funding for early learning and childcare, support for students, a $15 federal minimum wage, and much more. I'll let the Finance Minister go into more detail in a moment, but here's the bottom line. These measures will help you get through what is hopefully the last stretch of this pandemic. This is about how we set ourselves up for a stronger, faster recovery that includes everyone. So all parties need to work together to get this support through the House of Commons to Canadians as soon as possible. En terminant,
In closing, as announced this morning, I want to point out that Isabelle Hudon, current Canadian ambassador to France, has agreed to become the next CEO of the Entrepreneurs Bank of Canada, or EDC rather. Her experience in the field of business internationally and in Canada make her the ideal person for this role. She will be the first person to lead EDC and will be able to continue their excellent work in helping recover in the recovery of our small businesses. In her current role at the French Embassy, she has led a number of economic initiatives, and between 2017 and 2020, economic trade between France and Canada has been raised by 20%.
but there's reason to hope. With more people getting their shot and more vaccines on the way, we will get through this. And as we do, we're going to keep working together to rebuild a safer, healthier Canada and a stronger, more resilient economy that leaves no one behind. Before I pass it over to Deputy Prime Minister Freeland, I want to extend my deepest condolences to the families, friends, and victims of the tragedy at Mount Meron. Canada stands with the people of Israel and the Jewish community. Merci. Chrystia.
Okay, merci, Monsieur le Premier Ministre.
Thank you, Prime Minister. Today, I'd like to repeat some of the main pillars in Budget 2021 and some aspects of Bill C-30 that will provide practical help in what is still, for far too many Canadians, a period of worry and hardship. Make no mistake, despite our sustained efforts, despite the progress with respect to vaccines, COVID is still here. The third wave is still here. Therefore, passing these legislative measures is an urgent necessity.
This budget will create, in total, nearly 500,000 new training and work opportunities for Canadians. We're making a historic commitment to early learning and childcare. $30 billion over 5 years, reaching $9.2 billion every year in permanent investments. Within 5 years, families everywhere across Canada should have access to high-quality childcare for an average of $10 a day. Et je veux encore une fois.
And once again, I want to thank Quebec for its leadership, and especially feminists in Quebec for their leadership when it comes to this type of a childcare program.
$5.7 billion over 5 years in Canada's young people, doubling the Canada Student Grant for 2 additional years, and extending the waiver of interest payments on federal student loans through March of 2023. More than 350,000 low-income student borrowers will have access to more generous repayment assistance. Nous proposons d'élargir l'allocation canadienne.
We are proposing to broaden the Canada Workers' Benefit and to invest $8.9 billion over 6 years in additional support for low-income workers. This will provide additional remuneration for approximately 1 million more Canadians, and it will lift close to 100,000 people out of poverty. Moreover, the budget will establish a $15 federal minimum wage.
Businesses recover and grow. This budget contains a new Canada Recovery Hiring Program that will run from June to November and provide up to $595 million to make it easier for businesses to bring back laid-off workers or to hire new ones. We will also invest up to $4 billion to help up to 160,000 small and medium-sized businesses buy and adopt the new technologies they need to grow and become more productive and more competitive. And we'll encourage businesses to invest in themselves by allowing for immediate expensing of up to $1.5 million of eligible investments by Canadian-controlled private corporations in each of the next 3 years. These larger deductions will support about 325,000 businesses in making critical investments. Enfin, nous accordons.
Finally, we will be providing targeted support to the industries that have been most hard hit by the pandemic. In other words, the hotel industry, tourism, culture, and aerospace. We will reboot the tourism sector with a $1 billion investment. This is above and beyond the $2 billion we are granting to the aerospace sector. Quite simply, our priority is to make sure that Canadians can get back to work.
Budget is about growth and about jobs. It's about people. It's about making concrete, targeted investments to heal the wounds of COVID and to put Canada on a long-term track towards higher growth, towards greater prosperity, and towards a clean, green future. The Budget Implementation Act, tabled today, is the first major step in delivering on this plan. As the Prime Minister said, it also includes extensions and expansions of critical COVID-19 support programs for businesses and for people, including the wage subsidy, the rent subsidy, and recovery benefits. These supports are vital, as I have heard in roundtables across the country this week. And these supports will continue to be vital until the virus is beaten. The legislation also takes significant steps to drive future growth, investing in our social infrastructure and our physical infrastructure, in our human capital and in our physical capital. When enacted, this budget will make a measurable difference in the lives of millions of Canadians. I very much hope that our colleagues across the aisle will consider this legislation with the seriousness and indeed the sense of urgency that Canadians need right now. Thank you, Et maintenant, je pense que je donne la parole à nos docteurs. Oui, Monsieur le Premier.
And now does the floor go over to the doctors, Prime Minister, yes?
Bonjour à tous.
Good day, everyone.
This is the end of the National Immunization Awareness Week today. And it's a nice segue into National Physicians Day tomorrow. Not surprisingly, physicians are among the healthcare providers that Canadians trust most for vaccination advice. And during this long and difficult crisis, our debt of gratitude to physicians across Canada extends well beyond. But first, the numbers update. To date, over 1.2 million cases of COVID-19, including 24,169 deaths, have been reported in Canada. We are making progress nationally, but there are still a few tricky spots. Daily case counts have declined by 7% over the past week to an average of below 7,900 cases. Unfortunately, the number of people experiencing severe and critical illness continues to rise. Over the past week, an average of almost 4,400 people with COVID-19 were being treated in our hospitals each day, including over 1,420 people being treated in intensive care units. At the same time, an average of 50 deaths were reported daily. Variants of concern now represent the majority of reported COVID-19 cases, with the B.1.1.7 variant accounting for over 95% of variants sequenced to date. Taking a moment to acknowledge the important work that doctors are doing across Canada and around the world, we're reminded that the statistics we report daily are not just numbers. People who have been infected, those who have become seriously ill, and the families who have mourned a loss have all relied on physicians across the health system to care for and support them. Beyond this, physicians, like others across the healthcare workforce, have continued to provide care under some of the most difficult circumstances imaginable. Some are working tirelessly to provide direct treatment for patients. Others are working despite the challenges of COVID-19 in order to maintain the best level of care for patients in all areas, from emergency medicine to mental health, management of chronic diseases, and prevention programs, including immunization. As we did last year, on this day, we would once again like to acknowledge the leadership and support and dedication of our provincial and territorial colleagues. Working together has made us all stronger in leading Canada through the long and rough terrain of this crisis. We are a country of consensus and collaboration, and this event has required virtually around-the-clock collaboration to assess the evolving science and evidence, provide a vast range of public health advice, and share practical experience at every stage of the response. On behalf of our colleagues, I also want to thank Canadians for their continuing efforts. More than a year ago, when Chief Medical Officers called for massive changes to the everyday lives of Canadians, you rose to the challenge, and you have shown perseverance, kindness, and solidarity. Though we are in a difficult stretch right now, we are making progress. Public health measures having an impact, and with over 13.1 million doses of COVID-19 vaccines administered across Canada to date, and vaccine supplies increasing, we will get to better days ahead. As you continue with individual precautions, follow public health advice, and get vaccinated when your turn comes, please do not stop all the other things that are vital for maintaining your health. Seek immediate care for urgent issues, and keep up with health visits to maintain physical and mental health. Care for chronic diseases, and prevent future problems by keeping up to date with screening and vaccinations. Even after you've received the vaccine, hand washing, physical distancing, and mask wearing remain as important as ever. Thank you for staying as healthy as you can.
Bonjour à toutes et à tous.
Good day, everyone. The end of National Immunization Awareness Week today is a nice segue leading into National Physicians' Day tomorrow. Not surprisingly, physicians are among the healthcare providers that Canadians trust most for vaccination advice. And during this long and difficult crisis, our debt of gratitude to physicians across Canada extends well beyond. But first, the numbers update. To date, over 1.2 million cases of COVID-19, including 24,169 deaths, have been reported in Canada. We are making progress nationally, but there are still a few tricky spots. Daily case counts have declined by 7% over the last week to an average of below 7,900 cases. Unfortunately, the number of people experiencing severe and critical illness continues to rise. Over the past week, an average of almost 4,400 people with COVID-19 were being treated in our hospitals each day, including over 1,420 people being treated in intensive care units. At the same time, an average of 50 deaths were reported daily. Variants of concern now represent a majority of reported COVID-19 cases, with B.1.1.7 variant accounting for over 95% of variants sequenced to date. Taking a moment to acknowledge the important work that doctors are doing across Canada and around the world, we are reminded that the statistics we report daily are not just numbers. People who've been infected, those who have become seriously ill, and the families who have mourned a loss have all relied on physicians across the health system to care for and support them. Beyond this, physicians, like others across the healthcare workforce, have continued to provide care under some of the most difficult circumstances imaginable. Some are working tirelessly to provide direct treatment to patients with COVID-19. Others are working, despite the challenges of COVID-19, in order to maintain the best level of care for patients in all other areas, from emergency medicine to mental health, management of chronic diseases, and prevention programs, including immunization. As we did last year, on this day, we would like, once again, to acknowledge the leadership, support, and dedication of our provincial and territorial colleagues. Working together has made us all stronger in leading Canada through the long and rough terrain of this crisis. We are a country of consensus and collaboration, and this event has required a virtually around-the-clock collaboration to assess the evolving science and evidence, provide a vast range of public health advice, and share practical experience at every stage of the response. On behalf of our colleagues, I also want to thank Canadians for their continuing efforts. More than a year ago, when chief medical officers called for massive change to the everyday lives of Canadians, you rose to the challenge, and you have shown perseverance, kindness, and solidarity. Though we are in a difficult stretch right now, we are making progress. Public health measures are having an impact. And with over 13.1 million doses of COVID-19 vaccines administered across Canada to date, and vaccine supply increasing, we will get to better days ahead. As you continue with individual precautions, follow public health advice, and get vaccinated when your turn comes, please don't stop doing all the other things that are vital for maintaining your health. Seek immediate care for urgent issues, and keep up with health visits to maintain physical and mental health, care for chronic diseases, and prevent future problems by keeping up to date with screening and vaccinations. Even after you've received the vaccine, it remains as important as ever to wash your hands, maintain physical distancing, and wear masks. Thank you for staying as healthy as you can.
Thank you, Dr. Njoo. We'll now turn to the phones for questions. The Prime Minister will be around for a number of questions, and then the ministers and doctors will still be around afterwards for amount of time. Operator, over to you.
Thank you, merci. Please press star 1 if you have a question. S'il vous plaît, appuyez sur étoile 1 si vous avez une question. La première question de Raymond Filion, TVA. La parole est à vous.
Raymond Filion from TVA. Good day. Thank you, Prime Minister. there's been a protest against health measures that is going to happen tomorrow at this Olympic Stadium. Apparently, it will be an impediment to vaccinations that are planned there. I'd like to hear what you have to say to that. Answer. It is really maddening to see that people are reacting in this way. I realize that these are challenging times. There's a lot of anxiety, a lot of frustration that we're all feeling because of these public health measures. But these public health measures are in place to protect us, to protect our frontline workers, to protect our seniors, to protect our children, protect our communities. And we must continue to listen to our experts. Our public health care experts are telling us to get vaccinated as quickly as possible. They're telling us we should continue to wear masks. We should avoid any group gatherings. We should stay home. This is the way for us to get back to normalcy in our daily lives as soon as possible. Unfortunately, people that are getting together, gathering to protest, are actually prolonging, extending the need for these public health measures, these restrictions that we all find ourselves in now. So I would call on everyone to please do your part. Please be careful, reduce your contacts. This is how we will get through this crisis.
Pour revenir au Premier ministre de
Just a
l'Ontario.
second, Raymond, il m'en anglais.
In English?
I think it is really troubling to see people continuing and intending to come together and demonstrate against these public health measures. Of course, freedom of speech and freedom of assembly and the ability to express your opinions continues to be extremely important, even and especially during a pandemic, but it must be done safely. The irony here is that by gathering, people are putting each other at risk, spreading further cases of COVID-19, and extending the time in which we will have to be faced with restrictions and public health measures. We know people are tired. We know people are frustrated. Everyone is feeling this way. But the better we are at hanging in there a few more weeks, at getting vaccinated quickly, at making sure we're continuing to avoid gatherings, keeping our contacts low, being careful, wearing a mask, using the COVID app, these are the things that are going to get us back to normal as quickly as possible. And I know that's what we all want.
Oui, en suivi, j'aimerais.
Follow up. Mr. Trudeau, I'd like to get back to the Ontario Premier. He asked you yesterday to impose a mandatory quarantine for those travelers that are coming through the land border, and also to require a test before any domestic flights. Is this something that's on the table? Answer. We discussed a number of measures yesterday during that call. I can say, first and foremost, we will continue to work with the provinces and the territories to make sure that we are protecting Canadians. Now, as to the issue of borders, remember that over a year ago, we closed basically all of our borders to travelers. So only Canadians, permanent residents, and essential workers or exceptional cases can cross the border. So that's a reduction of about, there's only 5% of travelers are actually getting through the border now. Despite that, we needed strong, stringent measures. So we have measures. So anyone arriving to our border by plane or at a land border, these individuals have to show a negative test in the last 3 days. They have to be tested upon arrival. They have to immediately go into quarantine for 2 weeks. They will then be tested a third time on day 8 of that quarantine. These measures are being closely monitored by the authorities with extremely harsh penalties for people who don't comply. Now, as to the difference between a person arriving at a land border, whether that be by taxi or limousine, versus someone arriving by plane, you have to remember, Raymond, that there is a fundamental difference there. Anyone arriving at a land border is arriving from the United States has been tested over the last 3 days by the U.S. and is in the U.S. and has been in the U.S. since at least 2 weeks because of their own quarantine measures. So it's not the same thing as someone arriving directly from an international flight into one of our airports, and this is why we have more of these robust measures in place at airports. And we are closely looking at, we're monitoring the figures, the results of all of these tests to make sure that we are indeed protecting Canadians as much as possible. Of course, we will continue to work with the provinces. Now, with respect to domestic travel, Premier Ford expressed his desire to have more testing at land borders or between provinces. And these are measures that provinces can impose themselves. We've seen with the Atlantic bubble or in the territories, the Arctic, that the local authorities have put in some measures to restrict domestic travel, and that's been very effective. Ontario does have measures that it can take itself. Above and beyond that, we have offered to provide millions of rapid tests that we have that are not currently being used to full effect throughout the country. To, for instance, test people that are arriving at these airports. But even then, it would be up to the province to lead on that. But we are prepared to provide these rapid tests. So we are here to be partners at every step of the process, and always open to doing more.
We will always be there to work with the provinces and territories to keep Canadians safe. I think that is something that we've demonstrated from the very beginning. And we had conversations around a range of issues that we could move forward on last night. I think one of the things to remember, first and foremost, on international travel and people arriving in Canada is it's been well over a year that we actually shut down over 95% of all travel to Canada. The only people traveling across our border in any way right now are either permanent citizens or Canadians returning home, essential workers, and a limited number of exception cases that have squashed the number down to 5% of what it used to be in previous years. On top of that, everyone arriving in the country needs to show up with a negative PCR test from the last 72 hours, gets tested on arrival, goes into a strict quarantine for 2 weeks in a secure quarantine location, usually their home, with significant follow-ups and checks, and has to do a third test on day 8 to ensure that they're negative. These are measures that apply to everyone. And one of the things to remember as well is there is a fundamental difference between someone arriving at our land border versus someone arriving at an airport. Someone who arrives at our land border has been in the United States, has a PCR test from the US, even if they traveled internationally before because of US quarantines, has been in the US at least 2 weeks. And therefore, the measures that we put in place at the border, and we're following very closely the numbers and the data we collect on these tests, has been a extremely low and manageable number of cases. And we're always looking at doing more enforcement, at stepping up on the penalties on that, and we will continue to work with the provinces on that. But there is a fundamental difference between someone arriving on connecting flights from anywhere around the world at our airports, which is why we have required government-approved accommodations until the negative PCR test that they got on arrival is indeed furnished. But further than that, we will continue to work with the provinces, whether they want to look at rapid testing on arrival in airports across the country. We have ordered million. We have in our possession millions upon millions of rapid tests that are being underutilized across the country, and would happily furnish some to Ontario or any other provinces that want to test people on arrival, but they will have to work out the logistics on how to actually test everyone. But it's something that has been done. We watched the Atlantic provinces severely limit domestic travel with very strong measures. We watched the Arctic territories doing the same thing to extreme success. And they didn't require the support or the intervention or the permission of the federal government to do it, although we were happy to support them in any ways we needed to. Ontario has lots of tools, and we will continue to work with them on bringing in the right tools to keep people safe through this difficult third wave.
Next question, operator.
Thank you, merci. The next question is from Dylan Robertson from the Winnipeg Free Press. Please go ahead.
Good morning, Prime Minister. The Manitoba Premier says teachers will soon be able to go down to North Dakota to get vaccinated and come back to Canada without quarantining. Are you comfortable with provinces sending essential workers to the States to get vaccinated? And do you support waiving the quarantine and testing requirements?
I believe conversations are still very much ongoing around waiving quarantine requirements. That's something that I think all Canadians have a little concern around. The initial desire to get people who were crossing the border already, like truck drivers and others vaccinated in South Dakota, didn't require any waiving of quarantines. But we are working to ensure that people get vaccinated right across the country as quickly as possible, and we'll continue those conversations with Manitoba and others.
Follow up, Dylan?
And Prime Minister, the premiers of Manitoba and Saskatchewan say they're relying on the generosity of Americans because Canada's vaccine rollout is going so much slower. And I'm wondering what your response is to that.
We have been working incredibly hard across the country and around the world to deliver on vaccines. We started our vaccination program in December, and it has ramped up steadily ever since. We had a goal of delivering 6 million vaccines by the end of March. We actually delivered over 9 million vaccines by the end of March, and we have now increased massively and rapidly the pace of vaccination, such that we'll be receiving close to 2 million vaccines this week, 2 million vaccines from Pfizer alone next week and for the subsequent weeks, with more shipments of Moderna and others also coming in. So we are in the full ramp-up phase of vaccinations. We've seen provinces across the country highlighting dates in which the general population down to 18 years old will be able to be vaccinated in the coming month. And we've also continued to demonstrate extraordinary efforts to get more vaccines in quicker to Canada. We're now looking at over 50 million doses of vaccines in the country by the end of June. And as we've said from the beginning, every Canadian who wants to get vaccinated will be able to be fully vaccinated by September. Getting vaccinated is how we get through this, and that's what we're going to continue to work on with all our partners across the country and around the world.
Thank you, and we'll take one more question on the phone. Operator?
La prochaine question de Catherine Lévesque, La Presse.
Catherine Lévesque from La Presse Canadienne, Canadian Press. Yes, good day, Mr. Trudeau. I'd like to get back to the mandate that was given to Justice Arbour regarding the conduct in the military. There was an independent assessment that was already done 6 years ago, wasn't there? Answer. The Deschamps report 6 years ago provided recommendations, several of which were implemented by the government. Several of these recommendations. Of course, we need to do more. The reality of the matter is that there are too many men and women, or women and men, who do not feel supported when they share their experiences of unacceptable conduct and being at the receiving end of that within the armed forces. We need to create an environment. We need to make sure there's an environment in the armed forces where anyone who wants to share their experience will have resources and will be supported in the right way. So that's the case for these immediate changes, but also over the long term. It will not be easy to change the culture within the armed forces. We need Justice Arbour to make these concrete recommendations in order to act. But we won't simply wait the justice's report, wait for this report to come through. We are already acting with General Carignan, who will be heading a new unit to, as of today, directly receive complaints, allegations, experiences that could be brought forward. We know that we need to take concrete steps, and that's exactly what we're doing. Follow up? Yes, I understand what you're saying, Mr. Trudeau, but imagine if you were a victim waiting for some concrete action. I understand that some of the measures were inadequate, according to Madame Deschamps. There are more measures that are being considered by Madame Carignan. There is some issue about consultations to then have an independent process in place. But, you know, think of the victims. They're looking at the federal government and they're saying, when are we finally going to have an adequate examination of the situation? Answer, I fully understand that the current system is inadequate. Every time we hear from a woman, a survivor, a victim, anytime we hear that these individuals have shared their experiences in the media or anonymously, it's because these victims do not feel supported. They do not feel they are being listened to within the current system in the Canadian Armed Forces. And this is why we need to transform that culture in depth, and Justice Arbour will be providing her recommendations for the long term so we can act directly. But we're not waiting for Justice Arbour to complete her work. We have picked General Carignan so that we could have someone immediately who can provide support and reassure these survivors who want to step forward right now. Make sure that these individuals are heard, make sure that follow-ups are completed. And of course, in a year's time, depending on the recommendation from Justice Arbour, there could be an increase or a change or amendment to the mandate that General Carignan has been given. But we will not wait before we act. We are already acting now, and that is what all Canadian Forces members deserve.
Or Global National. I just want to pick up on that. You've had the Deschamps report for 6 years. One of the things that you can do right now is have that external review, which is what everybody's been asking for, but you've charged Justice Arbour with looking at that. So I'm trying to figure out what faith could victims have if you are just punting this down the road another 12 months when it's something you could have done today, you could have done 3 months ago, you could have done 5 years ago.
Over the past years, there have been many things done to counter the culture in the military, to provide better support to survivors, to anyone who comes forward with experiences or allegations of sexual misconduct or assault or harassment. We have brought in a number of measures. They have all been inadequate. Survivors continue to feel that they are not appropriately supported, continue to feel like the only thing they can do is either talk to the media or come forward anonymously. And that is a failing of the entire system. That is why we have tasked Madame Justice Arbour to work immediately to establish exactly what formalized, powerful processes are going to be adequate to provide proper support and to transform the culture of the military. But Mike, you're absolutely right. We should not have to wait a year before we can take action or provide support, and that is why we have appointed General Carignan who will be there right now to be able to support and to take in and follow up on any allegations or experiences that survivors wish to come forward and share. And as Madame Arbour does her work and make recommendations, which don't necessarily have to wait till the end and the final report, we will be able to adjust and modify. We need to make sure that anyone who has experienced harassment, intimidation, assault, or any unacceptable actions in the force has the confidence that they will be heard and supported as they come forward. That has simply not been the case in the past many, many years, and that's why we were taking action today.
And just on a follow-up, I wanted to go back to Tuesday when you said that you and nobody around you knew that the allegations against General Vance were of a Me Too complaint. But an email from a senior bureaucrat at the time referenced allegations of sexual harassment. Elder Marquez said that his presumption was certainly that it could be of a sexual nature. So at the time when you heard of the complaint, as a feminist prime minister with a feminist government, why didn't you ask if it was a Me Too complaint?
As we've said many, many times, as a government, we have always taken extremely seriously the responsibility to support anyone who comes forward. And supporting in this situation meant ensuring that this complaint was followed up by the proper authorities with the mandate to do that. Not followed up on by politicians, but by a rigorous process. That is what my office ensured, that complaint was directed towards the appropriate authorities. Unfortunately, they were unable to move forward, but that process remains extremely important to ensure that we're following up on it. But as we've seen, these processes are inadequate, have not led survivors to feel like they can come forward and hold the alleged perpetrators to account. That is why we are moving forward on strengthening the systems with the work to be done by Justice Arbour and General Carignan.
Oui, bonjour, Monsieur Trudeau. Laurence
Martin from Radio-Canada, CBC. I'd like to get back to this request from Premier Ford to restrict access from students to the province. Is this at the border? Is this something that will affect the next school year? Answer: several months ago, we worked with the provinces and territories on the matter, on the issue of international students. What we set up as a system is a system whereby provinces themselves would give border services a list of institutions, post-secondary institutions for the most part, that had adequate measures in place to welcome these students, ensure proper quarantining, and proper support for these students. The provinces themselves provided the federal government with the list of institutions so that we could allow for the entry of these students. So it's a system that required the participation, or a partnership rather, between the provinces and the federal government. Throughout the country, this is not a request that we receive to put a complete stop to international students coming through the border, because many provinces feel that they're doing a good job of managing these students and that they're not a huge source of cases. But last night, Premier Ford told me that he wanted us to suspend the arrival of international students coming into Ontario. So for that to happen, Ontario just simply has to set out a list of Ontario institutions that no longer want to have exceptions for international travelers. My office is currently working with Premier Ford's offices and the authorities in Ontario to do a follow-up to make sure that this approach is formalized. I heard it yesterday, but of course, there is formal work that needs to be done in order to implement this. And of course, we're still here to provide the support that the Ontario government may need at this point. The question inaudible to the interpreter answer, that's something we can look into with them. But other premiers from other provinces and territories have not made that request, so we will work directly with the government of Ontario.
Prime Minister Tom Perry with CBC. Do you think that anything that the Ford government is asking for in terms of these increased measures at the border, these restrictions on international students, do you think they're going to have much impact on the spread of COVID-19 in Ontario and in other parts of the country?
We know that importation through the borders is extremely low in terms of cases in the country. It's not zero, but we also know that at the borders there are series of tests. There is a mandatory enforced 2-week quarantine that has been effective in controlling the importation of cases and making them not the primary vector for new cases in this country. We are happy to continue to talk about strengthening the measures moving forward, and we will continue those conversations with all provincial premiers. But at the same time, we have seen that this third wave is very much around community transmission, and that's why we're sending supports. We're there with more contact tracers, with more rapid tests for enhanced screening. We're delivering vaccines. We're there to support the provinces as necessary while we're going through this third wave. We all have our roles to play, and we're playing them as fully as we can, but we need to stay focused on crushing this third wave and getting through to a much better summer.
We'll always be there to work with the provinces to limit the arrival of cases through the border. The closure of our borders for over almost a year now, except for a few exceptions, has been an extremely effective way of limiting COVID-19 cases in our country. We're always open to doing more, and we will work with the provinces on new measures. Of course, at the same time, we recognize that this third wave is characterized by community spread, and that is where we are also very much present to help the provinces with PCR testing, rapid testing, vaccines, healthcare workers, the Canadian Armed Forces, the Red Cross. We will always be there to support the provinces while they manage this third wave.
Prime Minister Chrystia, CTV National News. Ontario has said they are willing to pay for a $500 increase to the Canada Sickness Benefit for all Ontarians, but they've asked that your government help administer the program through the already existing system. You've said you will always help a province with requests during the pandemic, so why hasn't the federal government approved the Ontario proposal? Has there been any progress on this following your recent call with Ford?
The best sick leave, the best sick pay, is the one that you can wake up in the morning feeling like you have symptoms that are problematic. You can pick up the phone and call your employer and say, I'm not coming in today, and know that it's a sick day that you will continue to be paid for. That's not something that the federal government can deliver, with the exception of federally regulated industries. A couple of years ago now, the federal government moved forward so that employers in federally regulated industries could offer exactly that kind of sick leave. In provincially regulated industries, which is the vast majority of workplaces across the country, a number of provinces have moved forward, and territories have moved forward already with employer-driven sick leave. And the supports are also there for those employers with the wage subsidy, for example, which can be used, the federal wage subsidy, which can be used to support workers who are off sick. But it is the provinces and territories who are able to work with employers to mandate that kind of sick leave. In the fall, we brought forward measures on a 2 weeks, which we later extended to 4 weeks, $500 sick leave that people could apply for directly. And that, of course, would be most effective for gig workers like Uber drivers or others who don't necessarily have a direct employer that can grant them sick leave, and that money will be there for them. But yes, it is a less efficient and immediate process to get people sick leave than to go directly through the employer. But we continue to be there for people. We are happy to look at how we can help, and I can say that Minister Freeland has been engaged in this conversation with the premiers on this, and I can turn to you, Chrystia, for further reflections on sick care, the sick leave.
Yeah, thank you, Prime Minister. Look, the only things that I would add to what the Prime Minister has said is maybe emphasize the wage subsidy point. I think it's important for employers to understand that they can continue to claim the wage subsidy if they are paying wages of an employee who is off sick, and they can claim the wage subsidy for the employee that they've had to bring on maybe to do the work that that person who is sick isn't doing. So that's just to be sure that people are clear about that. And the reason I emphasize that is, as the Prime Minister has said, for people, for someone who is working, the best, fastest, most confidence do the right thing and stay home when you are sick is just to know that you're going to continue to be paid your salary. That's the thing that's going to give people the most confidence. And the people who can do that obviously are your employers. And so that's why we really think, you know, the way to help Canadians do the right thing, especially low-wage Canadians who may be worried if they lose that couple of days' income, they're not going to be able to pay their rent or buy their groceries. The best way to help people do the right thing is for employers to keep on paying their workers when they are sick. That's why, as the Prime Minister said, for federally regulated industries, a couple of years ago, we put in place 3 days of mandated sick leave. It's good to see provinces moving in that direction, and the wage subsidy is there to offer additional support.
Hi, Stephanie Taylor with the Canadian Press. You said in earlier remarks that the U.S. Requires people to quarantine for some period of time and that they're not transiting to Canada that way, but that's false. We know people, Canadians, are diverting flights to the United States and then crossing the border, circumventing Canada's hotel quarantine program. The U.S. has no mandatory quarantine order. So why are you saying this isn't happening, and what is your government going to do to immediately crack down on this?
Canadians who are returning from Florida or Arizona and landing in Buffalo or Bellingham are doing so by showing a U.S. PCR test. They are internal American travelers. Anyone transiting into an airport from into the U.S. from overseas needs to go through the U.S. arrival processes and land in the U.S. before leaving the airport and eventually driving to Canada, where they will need to show a U.S. PCR test. So there is a difference between people traveling from the U.S. through a land border versus people landing directly from Europe or Asia or elsewhere in our airports.
Thank you. That concludes the time the Prime Minister has. We'll go back to the phone for questions once he leaves for a couple of questions for the ministers and doctors.
Thank you, merci. The next question is from Tonda McCharles.